My name is Sarah Laslett, and I'm the Executive Director of the Oregon Nurses Association. I am really pleased and proud to have the opportunity to speak with you at the 2020 House of Delegates and to let you a little bit know about me and about what I'm imagining for ONA. I started in this job on March 6th, and as you can imagine, it has been a very steep learning curve ever since. This was not the start to the job that I expected. Between COVID and the pandemic and now the wildfires, it has really been a very steep learning curve, I imagine, for all of us. But I'm still really happy to be talking to you today. I want to tell you a little bit about my past so you know where I'm coming from. I was a labor educator for 15 years. I came to this position from being faculty at the University of Oregon Labor Education and Research Center. And it was actually in that job when I first moved to Oregon 5 years ago that I began to get to know ONA. I have done bargaining training, steward training, leadership development at Peace Health, at Peace Harbor, at McKenzie-Willamette, in the Good Sam system. I helped to facilitate the multi-union coalition at Sacred Heart. I worked on your bargaining unit leadership conferences. And I have gotten to know ONA pretty well over those 5 years. I have never been a nurse, but I have learned a huge amount about nursing in the last 5 years working with all of you. So I want to talk to you a little bit today about the opportunities and the challenges that we face at this particular moment in ONA and in Oregon. So let's start with the challenges of the moment. This is just amazing, really, what we are facing. And I have to say that I am humbled by the work that each and every one of you is doing every day to care for COVID patients and to take care of your families at the same time, to work in your communities. Really, what you're doing is really amazing. And it is so tragic that right now here in Oregon, we are facing almost 30,000 confirmed COVID cases and almost 500 deaths. Your heroism and the heroism of other healthcare workers and other essential workers just blows my mind. So thank you so much for the work that you are doing every day. So some of those challenges and opportunities in facing the pandemic, you know better than I do, but let me name a few that I think are particularly important. The first one is about safety standards and specifically PPE. It is totally unacceptable to me that your employers would not be providing you with adequate PPE up to the highest CDC standards every day in treating those COVID patients. We are making progress on getting you the PPE that you need, and I particularly would elevate the PPE committees that we are now able to establish in your facilities. I really look forward to hearing about the positive impacts of those committees. I also want to point out the opportunity that this gives us to really be powerful advocates for a public health system in the state of Oregon. We need it now more than ever. This pandemic has really revealed the weaknesses of our public health system and how essential it is. And I know that this is important to you, and I look forward to working with you to put more robust resourcing behind that public health system so we never find ourselves in this position again. You also really need those job protections while you are providing COVID care. And that's appropriate leave time, that might be subsidy for childcare. Where your lives have been turned upside down by this pandemic, you need job protections in order to keep on doing the amazing work that you're doing. We have had some success at being able to get some of your employers to negotiate memorandums of understanding with ONA to provide you with those job protections, but it's been spotty. There are some employers that still will not engage in that conversation with us. And so I want to support you in continuing to demand that your employers come to the bargaining table and actually negotiate those kinds of protections, which you desperately need and totally deserve. So those are some of the challenges and opportunities of the pandemic. And then there is, of course, the even more immediate challenge of the wildfires. This is unbelievable what's happening right now across Oregon. The number of people who have lost their homes, the number of people who have had to be evacuated, and all of us who are facing the challenges of this toxic cloud that has descended upon the whole western part of the state. So I know that you're also struggling with this. I want to tell you that I'm supporting you and that ONA is behind you and that we are going to do everything we can to help you through this difficult time. So what could possibly be the opportunity in this particular challenge? Well, I want to raise up one really important point, which is This also shows us now more than ever the way in which climate change is a public health crisis. And unfortunately, this is not the last time we're going to see this. And all of the kind of public health issues, including wildfires, that are going to emerge from ongoing climate change, we need to pay attention to that. And I know that you want to engage in that conversation, and I invite you to do that within ONA. The other challenge and opportunity that I would like us to think about today together is the challenge and opportunity of diversity, equity, and inclusion work. We have watched this Black Lives Matter uprising moment. We have seen the way in which racial health disparities have been expressed because of the pandemic. And we know that this is something that is not new. It's been going on for a long time in our healthcare system in the United States. And it continues and is even further revealed by a pandemic like coronavirus. We, as advocates for true public health, have the opportunity now, more so than ever, to speak against racial health disparities in our healthcare system. And we all know that there are some very specific areas of health and healthcare in which this is expressed very dramatically. Things like diabetes care, things like mother and infant mortality rates. I know that you want to make sure that every person who you care for who suffers from diabetes, or every laboring mother who comes into your facility, gets the best care that they can, regardless of their race, their ethnicity, their language, their sexual orientation, their gender identity, and on and on and on. This is our equity work in our sphere of influence, which is around healthcare. We also need to pay attention to how we are diversifying the nursing workforce. It is very important for patients to be able to see and speak to somebody who looks like them, who speaks like them, who has the same experience as they do. That's how you build trust in a healthcare system. And so I know that one of the things that's very important for ONA is to be able to really be an advocate for a diversification in the nursing workforce. So let's also think about the opportunities and the challenges in our political sphere. Nurses have a huge political voice. You are the most trusted and respected professionals in the world. And this means that in the 2021 legislative session in Salem, you're going to have the opportunity to argue for some really fundamental changes. We also know that because of the economic crisis that has been brought on by the pandemic, that the state of Oregon budget is going to be very, very weak. And so we need to be smart and think strategically about how are we going to ask for those changes? How are we going to advocate for the political changes that don't carry a huge price tag? And here's also where some of our opportunities lie. Thinking about disaster preparedness requirements for healthcare employers. Thinking about how do we maintain and perhaps even strengthen the amazing Oregon nurse staffing law so that it does not get suspended during a state of emergency, which to me seems completely counterintuitive. Why wouldn't we want staffing laws to be even stronger under emergency conditions? These are a couple of examples of the kinds of things that you will have the opportunity to participate in advocating for in 2021. So as we think about these challenges and opportunities, I want us to think about what the vision of ONA is and how it is that we carry forward the challenges and opportunities, the things that we are learning from these current moments into a future vision for ONA. So if I had to sum it up in one sentence, this is what I would say about what I would like to see ONA be and do, and that is the leading voice for healthcare justice in the state of Oregon and beyond. And in order for us to have that vision and to carry that vision forward, what we need more than anything is really deep leadership. We need all of you and your coworkers to see themselves as leaders in this conversation, in this discussion, in this fight for healthcare justice. And healthcare justice means so many different things. It does mean access. It does mean paying attention to racial health disparities. It does mean making sure that every person with diabetes, every mother and child gets the care that they need. It means that you are the ones who bring forward the message about what patients and communities and families need when they enter into a healthcare setting. And I want to offer you a framework that you may not have heard about before that really is the how-to of getting to that vision of healthcare justice. And it's called bargaining for the common good. If you haven't heard of bargaining for the common good before, I want to refer you back to some of the amazing work that we have seen recently that's being done by teachers who have really employed the bargaining for the common good framework. And when you think about teachers, that teachers' working conditions are student learning conditions. And I want to suggest that for you, patient care conditions are your working conditions. When we advocate for what's best for patients, we are also advocating for what is best for nurses and for other healthcare workers. So what does this look like? Well, can you imagine if we were using our contract negotiations, our political work, our community outreach to bring forward the interests of our patients, whether that is around transportation, housing, addiction treatment, so many other ways in which the social determinants of health are actually outside of the hospital. But we know that what happens outside of the hospital actually impacts how people experience what's happening inside of the hospital. And when we connect those things, when we connect the experience of patients and families and communities to the experience of nurses and other healthcare workers, then we're onto something good. We have the formula for what healthcare justice looks like. So I want to invite you into that bargaining for the common good framework. I want you to start thinking about how can you use your negotiations, your political engagement, your community engagement to really broaden what it is that ONA is and does and how we think about our mission and vision. I just want to say how grateful I am to ONA President Linda Pond and the Board of Directors for bringing me into ONA, for sharing the excitement about my vision for the organization, and for being such great partners as we move this work forward. So what's next? Well, at ONA, we certainly have a lot of work to do just to move beyond the challenges of the moment, and we will get there together, as difficult as this particular moment may be. But I want to elevate a few specific opportunities that are going to be coming up within the next year as well. We have our next cohort of the Nurse Leadership Institute. It's a 12-month program, and we are going to focus in 2021 on the theme of healthcare disparities. So if that is an issue that you are passionate about, I would really strongly encourage you to get involved with the NLI. We're also going to be doing our lobby day in 2021 in February. So all of those exciting legislative priorities that I talked about earlier, I want you to come to lobby day and be part of talking about that. We're also going to be doing our bargaining unit leadership conference, and there is so many opportunities throughout ONA to get involved, and I really want to invite you and encourage you to get involved. So as we share all of our challenges and our opportunities in this moment, I really want to just encourage us to treat each other with compassion, to be strategic in our thinking, and to remember that this is a marathon and not a sprint. And we will get through this time, we will emerge stronger, and we will continue to work together. Thank you.